He is our expert on health and wellness. He runs his own practice, keeping you from aging, keeping you from getting disease. We love having him on the show. Dr. Habib joins us in studio. Good to have you here.
Thank you again, Craig.
So early in the show, I talked about the Uber for medicine. What do you think of this idea that it's being streamlined? I'm driving in my car and I hear a radio show host who I know really well say he's got an app. And it's obviously an advertiser.
Right.
And they're saying download the app and the doctor will come to your house as if you went to the hospital and they guarantee to be out there within 2 hours. Now, as soon as I'm listening to that, I'm thinking like Uber, but I'm also thinking of guys like you and wondering where you took your practice, you were a doctor and you got tired of treating disease, so you've opened up your own practice to prevent it. We'll talk about that more in a moment.
Sure.
I was wondering, is that what doctors are doing? Are they getting out of the hospitals and saying, you know, I don't want to be in the hospital anymore. I can create my own proprietary type of self-employment setup through these types of models and go out to homes? I mean, is that what's happening? What are your thoughts?
So, you know, things changed, I would say probably in the last 5 years or so. Before that, everything was pretty much conventional. If you think about 30 years ago, it was all the house doc. The doctor came to the home.
So actually, maybe it's worked full circle a little bit.
That's pretty much the scenario. So, and it has come back the last 5-10 years. It sort of started coming back, even in San Diego, even when I was a practitioner. There were groups that were beginning to hire physicians to come in and treat the patient in the home. Then it grew. There are a couple actually in San Diego. And at the same time, telemedicine was starting to take off. I mean, that's billion dollar plus market there in telemedicine. It's been obvious that no company has been able to take the telemedicine market and go with it. There are a few different things out there now that allow you to do a FaceTime visit with a patient, usually same day, sometime next day, sometimes within a few hours. So this idea of taking the home visit doctor and then telemedicine and putting them together, I mean, I think it will be the future. The difficulty is how to implement it and to get people on board, and then how to bill insurances and or cash pay. So
insurances, that's another big topic right now. Recently, people just found out that their insurance premiums are going up, not making people very happy. Obviously, it's a big political issue. What are your thoughts on the whole insurance side of things?
Personally, I mean, I myself have a PPO. I pretty much treat my family. I got something in the mail about 2 weeks ago that said my premium was going to go up almost 30%. It's
no kidding.
Pretty typical now in California. Every state's going to be different. There's going to be some as much as twice the premium, but mine specifically went up about 30%. I've already heard from patients, the ones that I'm actually seeing that are coming into me paying cash, saying, look, I need to change my insurance. I'm even thinking of not having insurance, collecting the fee or paying the fee rather, and then just taking my chances. So if we're getting into a position where we're going to have to take our chances against something catastrophic and then pay cash, whatnot, then I mean, we really need to rethink things.
Yeah, and I don't really want to dive into the politics of it all, but it's rare that we have the ability to talk to someone who's an expert and who can look at this from a completely different angle. So the topic here is really Obamacare. Right. Do you think that it's a good thing, a bad thing? I'm sure it's not black and white, but what are your thoughts on it overall?
You know, honestly, the same way we got into the hospital sort of sick care management, we started paying out doctors based on not just how many patients they were seeing, but how well they were taking care of their patients. Physicians now get paid get paid like that. I like to look at it the same way for patients, to be honest. I think if we can devise a plan where if we can motivate everyone to sort of take care of themselves and allow premiums to change significantly, or even pay back patients based on achieving certain parameters, that's the way I would look at it. So, you know, the way it's set up now, it's kind of how are we going to penalize you based on the healthcare system? The healthcare system is extremely expensive. We're spending so many dollars on trying to keep drug costs within range. We're treating all these diseases. If we can start at the beginning and we can say, hey, look, if I can get you to lose 20 pounds, I can cut your healthcare costs by 70% over the course of your lifetime. That to me.
So let's talk about that, and we're running a little low on time here. I'll get away from politics and Obamacare. You personally have a passion around getting people off that disease treadmill and treating it with pills versus actually doing things that can keep you healthy. Give us some advice here today on what you're advising your clients on.
If I had to focus on one thing, just like a take-home message today, it would be be mindful every step of the way of what you're doing, what you're putting into your body, the way you're treating your family members, you know, what you're doing every step of the way, how you're sleeping, how you're managing your stress. Be mindful and attempt to make changes based on what you know you can do at that moment. So you don't have to be Deepak Chopra, you don't have to be Buddhist, but to be mindful every step of the way allows you to kind of make good choices. Most of us know what we need to do. A lot of it's all about motivation. If I can tell my clients or patients, aim at losing 20 pounds. You know, the average American carries 30 pounds more than they did 50 years ago. If we can lose 20 pounds, we feel better about ourselves, our self-esteem, we sleep better, we have more energy, you know, we
That's
cut the
genuinely
cost.
better for you as well.
Everything. The average person makes $10,000 a year more when they lose 20 pounds. I mean, there's so many factors. So being mindful and making good choices.
You heard from the health and wellness doctor. Be mindful. Have a state of awareness, state of consciousness. Awesome. Dr. Habib, thanks for coming on the show. Love having you
Pleasure.
on.